My name is Dr. Megan Dowling, and if you don't already know me, I'm a fifth-generation doctor of chiropractic, and my family's been practicing chiropractic now in San Jose for over 100 years. In addition to chiropractic adjustments, a big focus of my practice is nutrition as well. The fundamental philosophy of chiropractic is based on prevention and wellness, and nutrition obviously plays a huge role in that. So today I'm going to talk about the connection between inflammation and our overall health. The general public has been exposed to this concept that inflammation can play a huge role in our health for a while now. This article here was published in Time Magazine in 2004. But there really hasn't been much discussion about how big a societal problem this actually has become and what we can do about it, specifically with the 28 Days to Health program. So let's dive right in, and we will talk about what is inflammation. So inflammation is defined as our body's normal response to injury or irritation. And there are two types. There's acute inflammation and there is chronic inflammation. Acute inflammation is generally recognized as having four characteristics: redness, swelling, heat, and pain. And this is a really important process because it helps to initiate the healing process and clear out any pathogens by bringing white blood cells into the injured area. And this is a really important process because without this process, we wouldn't be able to survive. All right, but chronic inflammation is a whole different animal. Okay? This type of inflammation has none of the typical signs like redness, swelling, heat, and pain that we can actively identify. The definition is an inflammatory response of a prolonged duration, which is provoked by persistence of the causative stimulus. In other words, whatever is irritating the tissue isn't going away, which just leads to more irritation. And the problem is, we can't see chronic inflammation as easily as we can see acute inflammation. So we don't realize that there is a problem until a full-blown disease manifests itself, like in the case of heart disease. The first and most common sign of heart disease is heart attack. But the arteries have been inflamed for a very long time, leading to this buildup of plaque that eventually led to that oftentimes fatal coronary event. Basically, long-term inflammation, no matter which organ is affected, although usually it's a systemic or whole body problem, it's devastating to the body. So inflammation turns out to be the real cause behind many different illnesses. When you look at it this way, you can see that something like cancer has the same foundational cause as arthritis. Basically, these are all just symptoms of one problem: chronic inflammation. So we know that heart disease isn't caused by a lack of a statin drug, and we know that arthritis isn't caused by a lack of ibuprofen or Celebrex, right? So research shows that low-grade chronic inflammation is the real cause for 85 to 90% of all chronic disease. The good news is that all of these conditions can be managed and prevented by adopting an anti-inflammatory lifestyle. All right, so let's talk about how this happens. How does inflammation wreak havoc on our body? So let's think of our immune system, which is the system responsible for generating inflammation. Let's think of our immune system as a team of firefighters. Their top priority is to defend against potentially damaging threats or fires. But they also have really important repair and maintenance jobs to do as well, like fixing damaged tools, washing fire trucks, sleeping, eating, working out, that kind of thing. Your firefighters work really very hard when they are fighting a fire, but they also have periods of time when they are relatively relaxed. So there's a distinct difference between the infrequent responses to fires or acute conditions like traumatic injury or short-term infection versus having to battle those fires 24/7, which is the case in chronic activation of our immune system or systemic inflammation. So in a healthy immune balance, your firefighters respond appropriately to a 4-alarm fire. Your firefighters or your immune system ramp way up for a particular threat, which could be acute inflammation from injury or infection. But once that fire is out, immune activity decreases, allowing for repair, recovery, and maintenance tasks to be performed. So this is normal and represents a healthy, balanced immune response. Your immune system needs an on switch to ramp up for any kind of threat, but it's also just as important to have an off switch to allow for this recovery and repair time. So let's contrast a healthy immune balance with the example of chronic systemic inflammation. So in the case of chronic inflammation, as our firefighters, they responded to a threat here, and as they're winding down from this acutely stressful and demanding fire, they are told that while they're still expected to perform their normal repair and maintenance jobs, their job parameters have now increased to including sweeping city streets and collecting the garbage, maybe teaching some school kids and filling in potholes. So, wow. As if their original job description didn't entail enough responsibility, now they have a ton more work to do. If this was a one-time event, they could manage it. They would just do the extra work and then catch up on their normal repair and maintenance duties. But if this were allowed to occur for any length of time, it could cause serious trouble in the long term. Basically, it comes down to the fact that if certain factors like our food choices are overloading our immune system with too many tasks, it's going to be less effective at doing its main jobs, and something is going to be left undone or done ineffectively, like fighting off that bug that's going around, or healing that stubborn tendinitis, even keeping your arteries clear of plaque, or killing off abnormal cells so they don't become cancer cells. These are all very important repair and maintenance jobs of our immune system, and we can see if some of these jobs aren't done, they would cause serious problems. So let's talk about the motivation as to why it's important to get on board today and start getting healthier now. So let's talk about lifestyle-related disease. Okay, so lifestyle-related disease now accounts for 8 out of the top 10 causes of death. So we see here that lifestyle-related diseases are heart disease, cancer, chronic lower respiratory diseases, stroke, Alzheimer's disease, diabetes, nephritis or kidney disease, and influenza pneumonia. Okay, so the one thing that all of these things have in common are the fact they're caused by low-grade chronic inflammation. It's also interesting to note that the number one cause of unintentional injury deaths are actually due to pharmaceutical drugs. So in my mind, this counts as a lifestyle-related disease issue because if the person was healthy in the first place, they wouldn't be taking pharmaceutical drugs. Why else do we need to get healthy now? And one of these reasons is because our guts are sick. And you might think, well, okay, why do I care about that? But gut health is very important because it's intricately linked to our risk of developing an autoimmune disease. Autoimmune disease is currently the number 3 killer in the world, and all of autoimmunity is born within the gut. This is because 85% of our immune system is located within the gut wall. And the gut is the biggest and most important immune organ of the body. Beneficial bacteria that reside within our gut actually help to shape our immune system and tell our immune system what is normal and what is not. So if the gut flora is abnormal, then our immune system won't work. This goes back kind of to the concept of the firefighters. If our immune system is bogged down with environmental toxins, the wrong type of bacteria is in our gut, and we're eating all the wrong types of food, then we're going to be susceptible to all forms of disease, including and most especially autoimmunity. So autoimmunity is the process in which the immune system starts attacking the body's organs. Whereas a well-trained immune system would look at something like the thyroid and say, well, that's myself. I'm not going to attack myself. But in the case of autoimmunity, your immune system thinks that your thyroid is the enemy and so it starts attacking your thyroid, which can lead to one of the well-known autoimmune conditions, such as Hashimoto's thyroiditis, which is the number one cause of thyroid disease currently. And other examples of autoimmune diseases include ulcerative colitis, rheumatoid arthritis, lupus, Crohn's disease, IBS, multiple sclerosis, and type 1 diabetes as well. So there are over 80 different autoimmune diseases overall. In order to get an autoimmune condition, you have to have these 3 criteria, okay? So you have to have a genetic tendency for this condition. So maybe somebody else in your family had it. You have to have a type of trigger for this autoimmune disease. So maybe it's an environmental toxin, or maybe it's a food sensitivity, that kind of thing. And also, you have to have intestinal permeability. So intestinal permeability is also known as leaky gut, in which the gut is so inflamed that it's allowing these big protein molecules to pass through the gut wall and activate and confuse the immune system. So the neat thing is that by eating an anti-inflammatory diet, as I plan to teach you in the coming weeks, we will eliminate 2 of the required criteria that are needed in order to develop an autoimmune disease. We will eliminate your trigger, and we will eliminate and start to heal the leaky gut or intestinal permeability issue. So if you already have an autoimmune disease, it's also going to help decrease your symptoms and help you get into remission. Something else that we need to keep in mind when we're talking about why we need to get healthy now is that we need to admit that we cannot afford to be sick. Okay? Every 30 seconds, someone in America files for bankruptcy due to the aftermath of a personal health problem. And if you're thinking, well, I have insurance, so that can't be me, you're wrong. Because 70% of people who go into debt due to a medical condition had health insurance at the time of diagnosis. So let's give you examples of what some of these conditions can cost us if we choose not to take care of our bodies now. This is the example of a hip replacement, which is caused by osteoarthritis of the hip, and osteoarthritis is considered a lifestyle-related disease. So a hip replacement can cost $49,000, and that's not including rehab, the time lost off work, and a loss of quality of life. A heart attack will set you back about $45,000 to $50,000, and an additional $850 per day if you should need to be in intensive care. And average cancer treatment costs $375,000. This is not including so-called extravagant drugs that help reduce chemotherapy-induced nausea, which can cost up to $100 per pill out of your pocket. So for many people, insured or not, these diseases mean losing their house, losing their life savings, and definitely losing their quality of life, all from a preventable lifestyle-related disease. A chiropractor that I know says it best when he says people spend their health trying to gain wealth, only to eventually have to spend all that wealth trying to regain their health. And unfortunately, this is definitely the norm in our society today. All right. So why else do we need to get healthy now? Because we are so tired of dieting. The ultimate goal of this program is to get you to the point where you will never need to go on a diet again in your life. And what we want to address in this program are some of the fads or trends that have not proven to be beneficial. And one of the biggest trends that has done a lot of damage to our society is the low-fat diet. So despite years of our healthcare system and the media pushing a low-fat diet, why is it that today we're still the world's fattest country? It literally doesn't make sense. So the low-fat diet didn't work because, as we can see here, 1980 is when we were told to follow the guidelines of a low-fat diet, and since 1980, our obesity rates have skyrocketed. Okay, so what happened with the low-fat diet is that they took out the fat and they replaced it with sugar. And in the end, we're all fat-soluble vitamin deficient, which makes us more susceptible to autoimmune diseases, osteoporosis, heart disease, cancer, basically all forms of chronic disease. The real shocking truth here is that fat makes you thin and sugar makes you fat. These types of dietary myths are what we're going to go over in our 28 Days to Health program. And in doing so, we're really going to clear up the confusing and somewhat contradictory world of nutrition and make it easy simply to know what is good for you and what is bad for you. We also need to get healthy now because people are living longer, but their bodies aren't necessarily ready for that type of longevity. So 100 years ago, people had a life expectancy of 50 years. That means 100-year-olds today have outlived their life expectancy by 50 years. Only their bodies weren't prepared to live those extra years because they grew up with processed foods, smoking, lack of exercise, and industrial pollutants. Today, these people are stuck in nursing homes with a severe lack of quality of life. We all view nursing homes as places that we really don't want to end up in our old age. So we need to prepare our bodies for this kind of longevity. Otherwise, you will not look forward to living to the ripe age of 100. So now we're going to talk about what is going on. What is making us so inflamed? Well, our food plays a monumental role in this epidemic. Sugar, processed foods, and bad fats are causing chronic inflammation in our bodies that eventually start to break down our organ systems. The truth is that the food that we eat has a profound impact on our body's inflammatory state. We need to get used to the idea that the foods that we eat either make us more healthy or less healthy. Those are our options. There's no food neutral or food Switzerland. Every single thing that you put into your mouth is going to make you either more healthy or less healthy, period. The reason behind this is because our bodies are designed to make pro-inflammatory and anti-inflammatory compounds from the building blocks that we give to it by eating the certain foods in our diet. Pro-inflammatory compounds are made from nutrients in order to help us fight infections. And anti-inflammatory compounds are made to moderate and turn off our body's inflammatory response, which we learned was a very important part of a healthy, balanced immune system when we talked about our firefighter example. So our bodies require a balance of these compounds to remain in an inflammatory neutral state. Today, because of extensive food processing, the typical Western diet has 30 times the amount of pro-inflammatory compounds than it did a century ago. And because of this, our bodies are primed for out-of-control inflammatory reactions. So getting an infection, an injury, or even simple wear and tear can create that spark that literally can set our bodies on fire. So this is an example of the standard American diet, aka the SAD diet, because everything that we see in red here is inflammatory. We see that 10% of our calories come from dairy, 1 to 2% come from alcohol, 20% comes from refined grains, pastas, cereals, breads, 20% from refined sugar, 20% from refined seed oils, 15 to 20% from obese meat, and less than 10% of our calories come from vegetables and fruits. So you can see if we're eating a diet that's primarily inflammatory, our bodies are going to become grounds for inflammatory destruction. So what's making us so inflamed? Let's talk about some of these culprits for a minute. Refined sugars and flours are simple carbohydrates that, when consumed, lead to a spike in our blood glucose. In response to this, the body secretes insulin, which drives that glucose into cells. This is the normal response. But let's say that your cells are full because of that bagel you had for breakfast this morning. When this extra glucose is rejected from the cell, it remains within the bloodstream, and then it requires more insulin to try and convert that glucose into fat for storage. Sugar that remains in the bloodstream for longer than it should also attaches to proteins, which act like a barbed wire coating that ends up injuring vessel walls. Imagine a barbed wire covered little ball bouncing around on the inside of your delicate blood vessels. This is one way that sugar and simple carbohydrates can cause systemic inflammation. Bad fats are making us very inflamed as well. And notice I say bad fats. Good fats are a completely different story, and we will talk a lot about them in this program. So, compared with prehistoric times, that would be on this end of the scale here, the ratio of omega-6 fatty acids, which are inflammatory, to omega-3 fatty acids has increased at least 20-fold to now at least 20 to 1. When the balance shifts from this unhealthy level of omega-6 fatty acids, cells start to produce these compounds called cytokines, which directly cause inflammation. This inflammation builds up within our bloodstream and also affects the muscles, joints, and organ systems, since they all rely on a steady supply of blood to get their oxygen. So this is how we get the systemic effects of inflammation from our bad fats. This is an excellent piece of evidence that suggests that high omega-6 content, tissue content, correlates with heart disease. Or a better way to look at it now, since we know what omega-6s do in the body, is that inflammation causes heart disease. We see here that the USA has the highest tissue omega-6 fatty acid content, and we are at highest risk for heart disease mortality here. And what's interesting is that when we look at some of these other cultures, like Japan, the Mediterranean, Greenland, what's interesting to note is that these type of cultures rely more on fish, which may have a higher omega-3 anti-inflammatory content in their diet, and because of that, they have lower tissue omega-6 fatty acid content, therefore lower risk of dying of heart disease. Another issue that's making us so inflamed is, unfortunately, our own body fat. I bring this up because 2/3 of adults are obese or overweight, and almost that amount of our children as well, which is really scary when you realize the impact that our own fat has on our body's inflammatory status. Once you become overweight, the subcutaneous and visceral fat is actually considered to be an extra organ. This fat tissue is capable of producing its own pro-inflammatory compounds and hormones, such as estrogen and a hormone called leptin, which makes you lose control of that signal that tells you to stop eating. Research now shows that blood delivery to the fat can't keep up with the growth of fat. So cells become starved for oxygen and release more pro-inflammatory compounds to try to induce that blood vessel formation. So obesity is a red flag that you are at much higher risk of all the chronic diseases that we've mentioned earlier, including diabetes, heart disease, and cancer, all because of the tremendous effect that extra body weight has on the inflammatory state. All right, lastly, what is making us so inflamed are toxins, the toxins that are found within our environment. There are 74 billion pounds of over 80,000 chemicals that are either being imported to or produced in the United States every single day. And this doesn't even include things like pesticides, food additives, pharmaceutical drugs, fuel, or vaccinations. Mercury is one of the most toxic substances known to man, and yet it can be found in all of us, commonly through our food and water supply, but also our biggest source is vaccinations, especially the yearly flu vaccine. Chlorine is something that we are all exposed to through our water supply, and it has been found to kill beneficial bacteria within the gut, which impacts the entire immune system. Also, as it says here, cancer risk among people drinking chlorinated water is 93% higher than among those drinking water that does not contain chlorine. Low-level chronic exposure to toxins have a huge impact on chronic disease, and conditions like asthma, eczema, food intolerances, and sensitivities all increase in incidence the more toxins are found in our environment. It can be argued that any disease process can be either caused by or complicated by our toxic load. All right, we can't get away from them, and toxins that enter our body from the foods we eat, water we drink, air we breathe, and from the chemicals that we put under our skin all have a profoundly inflammatory effect on the body. Once they get in, because they are so toxic, your body tries to store them in places where they will have the least immediate impact on our overall health. And these places tend to be either our bones or our fat tissue. And once they become stuck here, they are really hard for our bodies to eliminate on their own. This has very important implications when we are talking about weight loss. Okay, as this image explains, just dieting here will result in fat loss. But because losing that extra fat increases our toxic density, our body's solution to this extra pollution is dilution. So your body's going to want to gain weight back a lot faster if it's still dealing with this toxic load in order to mitigate the effects of those harmful toxins. That's why a crucial step in weight loss is dealing with your toxic load. If we can deal with the toxins, then our body has no reason to hang on to that extra weight. Right, so far we've talked about lifestyles contributing to our risk of developing a disease. All that being said, what about your genes? A lot of people like to point out, my dad, my brother, and my uncle all got heart disease. So at some point in my life, I'll probably get it too. But that's not the whole story. Certain diseases do have a genetic component to them. But the good news is that we are in complete control as to whether these genes get expressed. Studies show that diets high in sugar and processed foods lead to the methylation or turning on of genes that are linked to the expression of diabetes, heart disease, cancer, Alzheimer's, etc. Also, conversely, it has been found that a diet low in sugar and bad fats can, in effect, prevent the expression of these very same genes. So it turns out that it mostly matters what environment those genes are in. It's been said that genes may load the gun, but it's the environment that pulls the trigger. And living a healthy anti-inflammatory lifestyle can help you push those diseases in your family history far off into the future, or probably prevent them from even happening at all. So, how do we deal with this epidemic of inflammation and lifestyle-related disease? Despite spending more than any other country on healthcare, we currently rank 37th in terms of overall health of our nation, which should be completely unacceptable. It is time for a new healthcare paradigm. Going to the doctor nowadays doesn't make you healthier. It actually makes you sicker because each time you go, you get placed on a new drug. And this new drug probably has side effects that you will likely need a new drug for. We need to learn that health is an individual responsibility. It's up to you to learn how to maintain it and to protect your body's potential for self-healing as you go through life. No doctors, no treatment, and no system can do this for us or force us to do it on our own. So it would be really helpful if we learned to think about healthcare in a completely different way. And this is where a new healthcare paradigm comes into play. So healthcare can be organized into 3 separate tiers. The first one is self-care. This is where we start. This is what we must do for ourselves in order to keep our mind, body, and spirit healthy and functioning at their highest level, which nobody else can do for us. Nobody else can go to the gym for you or eat healthy for you or take your vitamin D for you. It's your responsibility to keep yourself in this tier as best you can, as often as you can. The second tier is healthcare, real healthcare. This is what you must do for yourself in order to keep your mind, body, and spirit healthy and functioning at your highest level, utilizing the skills of a trained healthcare professional. For example, in order to keep your body in alignment and your nerves efficiently communicating with the rest of your body, chiropractic care is something that can support your body's unique ability to self-heal. Chiropractors are also trained in nutrition, much more than medical doctors, so we are also the people to turn to for dietary advice and nutritional testing. And lastly, last tier is crisis care or sick care. This is what you must do for yourself in order to recover from an injury or illness that requires the support of a crisis care specialist. For example, if you get into a bad car accident or you have a heart attack, you need emergency medical attention. The first place that you should go to is the emergency room. What crisis care is not is long-term management of chronic disease. That is the key to this whole new healthcare paradigm. Medical doctors should only be used for crisis care because that's what they're trained to do. They are not trained in nutrition, and in medical school they do not learn about how to keep the body in its optimal state of wellness without using crisis care tools like drugs or surgery. So a lot of people ignore these first 2 crucial steps and end up at crisis care as their first form of health care. That person who does that is in for a rude awakening when that first heart attack they have kills them, despite the fact they are taking a statin drug, a beta blocker, and their daily dose of baby aspirin. So we cannot ignore these tiers of self-care and healthcare and expect crisis care to fix us and make us all better. There's really no denying that if this was the currently accepted healthcare model, it would save our country billions of dollars, but more importantly, people would be living healthier and happier lives. So let's talk about that most important tier, our self-care tier. Okay, what can we do about our health right now? So this is what we can do to take care of ourselves using an anti-inflammatory lifestyle. That is why I wanted to introduce this program, 28 Days to Health, to my patients. When I was in chiropractic college, I thought I could just adjust away people's problems and then they would come back in every now and then to get a tune-up and be on their merry way. But when I first started practicing, I suddenly realized that people's neck and back pain weren't their main problems. Many were obese. They had thyroid conditions, diabetes, heart disease, and cancer. Kids were taking prescription medication. Adults are taking 3 or more prescription medications. And really, their problems were much bigger than I think most of them realized. Most of them don't realize that 5 years down the road, they will be even in worse health than they are now, since these are all signs that their bodies are already deteriorating. I realized that people needed my help, not just to stay healthy, but to actually get healthy. And that is why I decided to bring in 28 Days to Health. So this is what we're going to learn in the 28 Days to Health program. We're going to learn how to literally care for ourselves, which a lot of people think they know how to do. But if they did, then we really wouldn't be suffering these alarming rates of chronic disease that we are today. So we're going to learn how to implement all the facets of an anti-inflammatory lifestyle, such as minimizing our intake of inflammatory foods and minimizing our exposure to common toxins. Also, how to maximize our body's natural detoxification pathways. We're going to learn how to maintain appropriate hydration levels. Also learn how to prepare balanced, nutrient-dense foods. This is a key for a new healthy lifestyle. We're also going to learn why we need to avoid common criminals in the diet that deplete our health. We're going to learn about how to improve our body's pH to maximize health. And we're going to supplement effectively to meet our weight loss and health goals. So we're going to ultimately learn that eating healthy is an investment in our health, and it is truly much cheaper and way more fun than having to manage a chronic disease. And for your efforts, you will get some pretty neat rewards, all within a very short period of time. And most of which, all these benefits are due to changing your body's environment from an inflammatory state to an anti-inflammatory state. So very often, I've been running this program now for, 4 years. And we very often see a dramatic loss of body fat. We see an increase of lean muscle mass through measurements on the tinnitus scale that we use every meeting. Improved mental clarity, improved mood, increased energy, enhanced athletic performance. I've had athletes through the program and report better times and faster recovery, that kind of thing. Definitely reduced allergy symptoms and a measurable reduction of high blood pressure. Also reduction of high cholesterol. I have some amazing pre-28-day lab reports and post-28-day lab reports. I had one lady drop her cholesterol 100 points within the month that she did my program. And also improved intestinal health. Definitely elimination of headaches, muscle, and joint pain. A lot of times I just have people do this program in order to have them stop coming in to see me every week because they need the chiropractic care. But these are all just signs that, again, if you're in pain that often, your body's in an inflammatory state and we need to turn that around. We definitely see improved blood sugar levels and clearer skin. I also should add to this list that we can improve fertility using this type of lifestyle as well. I had a patient who couldn't get pregnant. She'd been trying for 2 years, and literally 1 month after she completed this program, she got pregnant. So all just amazing benefits within, again, just a very short period of time. Okay. So, it's been also objectively proven that intervention like 28 Days to Health have long-reaching health benefits. I'm currently going for my diplomate in clinical nutrition, and while reading one of my textbooks one day, I came across this statement here: a hypoallergenic diet that's supplemented with a broad-spectrum macro and micronutrient drink, an intake of at least 2 quarts of filtered water per day, produced significant improvements in objective measures of intestinal permeability and hepatic phase 1 and phase 2 detoxification capacity. And I know that's a lot of technical words and terms, but trust me, this is exactly what this program is, summarized down into one paragraph. The results were found in both people with chronic disease and in symptom-free individuals. And this whole conclusion was determined by these two separate studies that were both published in the Journal of Alternative Therapies in Health and Medicine. And if you need some more evidence, this is another study, a few other studies that showed an anti-inflammatory ketogenic Mediterranean diet, aka this program, when adhered to for 12 weeks, reduces systemic inflammation by reducing cardiovascular risk factors, achieves 100% resolution of metabolic syndrome. This is a condition that affects 1 in 4 Americans, and it consists of a high blood sugar, high triglycerides, and a large waist circumference, basically prediabetes. So 100% resolution of metabolic syndrome. No drug can do that. And then also can reduce or resolve non-alcoholic fatty liver disease. And basically, when you're over 6 years old, 2 out of 5 people have non-alcoholic fatty liver disease. It's known as actually the most common disease in America, but few people know they actually have it. It's a major risk factor for diabetes, heart disease, and cancer. Okay, so these studies all found that this type of diet can help in each one of these areas. So before we end this video, let's check in with you personally. How do you feel? How old are you versus how old do you feel? Okay, if you feel your age or older than your age, then you are depriving yourself of a level of quality that you should be enjoying in your life. You can and you should feel younger than your chronological age. So how you feel is greatly determined by your level of energy. If you're overweight and out of shape, then your body is using excess energy in order to just maintain your current level of survival. If you are sick and suffering from chronic injuries, then your body is just trying to heal itself. The law of conservation of energy says that energy can't be created or destroyed, but it can be redistributed. So why do you think we get tired when we have the flu or a cold? It's because your body is redirecting energy towards healing itself. And when you adjust your lifestyle the way we're planning to, energy that was being used just to heal yourself or sustain yourself can be freed up and used in ways that you actually want to use it. So the bottom line is, if you knew you were going to live 100 years, wouldn't you take better care of yourself now? Okay, you're going to want your body to be prepared for all the miles that we may put on it. Otherwise, if you're lucky enough to live that long, living to 100 won't be something that you look forward to. And remember, one of my favorite quotes, food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. Ain't it the truth? So start thinking this way and at least keep that in mind when you have dinner tonight. And we will live this for the next 4 weeks. Okay, so some details about the program here. It's $100 for all 4 e-classes, and this includes the class manual, ebooks for recipes, and 4 weigh-ins with me. We weigh in once a week, and also it covers the 4 e-classes may be distributed in 15-minute increments. So we're going to be sending out emails every 15 or every other day. So it makes it easier to consume that much information. And then we also, each of your weigh-ins, we're going to measure for body fat percentage, water percentage, visceral fat, muscle mass, your basal metabolic rate. These will all be measured and recorded throughout the program to assess for change. And then also, there are tools available for you in order to make the program easier and more convenient to follow. So the program requires that you have completely balanced meals for all 3 meals out of the day. And that can be really difficult to do while you're in the process of learning how to do that. And since it's really hard for most people to take the time to eat a balanced breakfast before they head out the door, a protein shake is a really good option. The protein shakes are made with protein powder, fiber, greens, fish oil, detoxification nutrients, and also an anti-inflammatory blend. So they are super nutrient dense and keep you full for hours. Just by replacing one meal a day with a shake, you will feel so much better, even if you didn't even do anything else. So that's because the shake provides you with basically a multivitamin and multimineral. It's a great source of omega-3 fatty acids and antioxidants and probiotics and detoxification nutrients and fiber. So what your body is typically missing is supplied in a really easy-to-make shake that turns out to cost less per shake than a highly inflammatory McDonald's Egg McMuffin breakfast. It's about $3.50 a shake. So these products will help you efficiently eliminate stored toxins that are causing inflammation and keeping you from losing the weight. All of these products are gluten, dairy, sugar, soy, and GMO free. They're all organic, so they fit perfectly within the program. And I could never endorse anything that I didn't know truly worked. And I know from my past experience of teaching this class for 4 years that if you utilize these tools, you'll get the most out of the program and maximize your overall results. So this is just for 28 days, and then you can choose to do whatever you want, but I know that this is a step in the right direction for everyone. And if you could change your life in 28 days, why wouldn't you? So I look forward to working with you, and I will see you soon.